Okay, everybody is welcome to today's talk, and we are going to educate you all and just share as much as we possibly can on your cycles and reproductive health. So myself and Dr Codruta are here today to share as much information as we can. So my name is Ailish. I am a neo-fertility and femme-trained fertility advisor, and I really want to help women understand their bodies and just take back the power and the control and just not be pulled along not understanding and not knowing things about their reproductive health. Dr Codruta?
Oh geez, I have to speak. Hi guys, my name is Dr Codruta Pandalache. Half of you won't remember my name, but you will if you really must. I shouldn't be looking at the slide because I know who I am. I am living in Ireland for 19 years and I've been a doctor for approximately 18 and a half. Over the last 4 years, I've joined the Restorative Reproductive Medicine world, and together with Ailish, we are working as a very good team in supporting your fertility journey. So I do look at your cases with different eyes. We look at the root cause of your infertility, subfertility, primary or secondary infertility, failed IVFs, low AMH, you name it. So whatever the cause might be, we take a deep dive into the whys, and once we know the whys, we will know how to fix it and get you there. I also specialize in women's health and men's health, so it's not all babies. I do adore babies, but together today we will look through how to understand your body and what signs our bodies are giving us month by month.
So would you like to introduce
I'll do that,
Lauren?
yeah. So just a little bit about restorative reproductive medicine. First of all, it's a mouthful. As you can see, I'm trying my best. RRM is basically a medical approach that identifies and treats the root cause of your infertility. When people say unexplained infertility, it's actually unexplored or very poorly explored. So what we do is we work always with a fertility advisor who's Ailish to understand your fertility cycles. How do we do that? We do it by using a specialized app, which you will have to input your details every night, how you feel, if you have mucus, if you don't have mucus, do we have a positive ovulation test, how was your bleed, was it light, was it heavy? So looking at this and looking at the root cause, this makes restorative medicine what it is, okay? So understanding a lot. The vital sign, obviously, unlike conventional approaches that suppress the cycle, we work with your natural cycles. So this is restorative reproductive medicine in about 60 seconds.
Yeah. So as Codruta was saying, you will use a chart together. So your chart is basically like your monthly report card. It's going to give you such an in-depth understanding of your body. It's not like any other app out there that's used that might just track, like, say, your bleed or your LH. It's going to track your bleed in depth to really understand your period. And the reason we need to do this is because the quality of your period is telling us about the hormones from the previous cycle. Your period is so indicative of what's going on. We'll then track your cervical mucus, and you might see online that, okay, this lovely egg white cervical mucus is so important for fertility, but if that's all you're focusing on, that one tiny part of mucus, you're missing so much. Then we'll obviously incorporate your LH and your temperature. So we use a little device called Tempdrop, and we will ask any of the women who are using it to wear it every night, and it will read your temperature every night. And together, when we combine these biomarkers and track everything daily, we create the fertility chart. And it is such an important diagnostic tool in restorative reproductive medicine, because then we can go to the doctor with that chart and she can see it all. She can see it all. She can see when she needs to, time your blood test. She can see when the follicle is developing, the quality of that follicle. And then she can also time a blood test in your luteal phase, which is commonly, unfortunately, overlooked.
And this is where I have to speak again. How do we doctors use this chart? You might think, well, she's a doctor, she's prescribing, yes, but how do I prescribe? Based on what? So I tell all my patients when we have the initial consultation, if you don't chart your cycles, and if I can't see it, I don't know how fertile or infertile you are. I don't know how to give you targeted fertility treatments, I don't have two patients on the same treatment. I don't, because no two women are the same. I might look at your chart and say, oh wow, this is a very short cycle, your luteal phase is way too short, you're not going to get pregnant. And then I'm going to start asking myself, why does she have this short luteal phase? Is she missing progesterone? What's happening there? Or I might look and say, wow, 45-day cycle, that is not normal. So the cycle charting is giving me the most important tool to help you in a personalized way. If you don't do it correctly, I hesitate because I don't know, was that mucus? Do you actually have mucus? Will that mucus impact how the sperm survives in there? So all my patients, they hear the same thing. You contact Ailish, start charting your cycles, give me access to your chart, I'll give you the best treatment. You give me a poor fertility chart, I'll try to give you the best treatment to get you there quicker, but it's hard for me. It's like me trying to see something in the fog. I see it, but I'm not sure of it.
And I just want to kind of add on there to what Dr. Codruta was saying. For anyone who doesn't know what cervical mucus is or what it does, it's really important to understand it. Basically, your whole body communicates. So when your follicle develops within your ovary, it sends out the hormone estrogen, and this estrogen literally goes to your cervix, and imagine it knocking on the door saying, hey, start to produce mucus. When it produces mucus, it changes the pH of the vagina, allowing sperm to survive. It is an absolute crucial component of natural conception, and it's commonly overlooked. And again, this is how restorative medicine is different. It's to identify, is there something we're missing? And the chart does that. It's on any journey, the chart should be used. But I'm just so thankful that it's used in restorative medicine, and doctors like Codruta understand this and apply it with all of their patients.
Again, me.
Take it away.
Well, I kind of mentioned that. So, if I look at the chart and I see that somebody finished her cycle on day 5, and then she has an LH test positive on day 7, I will see that ovulation is happening too early, so that follicle is developing too fast. We might not have a very good quality if that happens, but I do see patients pregnant on day 8 of their cycles. Or else I can see a very late ovulation or the follicle struggling to develop. You know, when you have mucus, as Ailish told you, or wetness sensation for 10 days. You're like, oh, that has to be good because I have mucus. And then myself and Ailish will say, actually, it's not good because the follicle takes too long to develop. You might have PCOS. That follicle is not developing properly. So again, follicular phase problems, I can see them and I can diagnose them from your charting. So it's important to chart your cycles properly for me to understand your fertility.
Yeah. And I think another thing, there are so many people, it's really commonly, used LH test strips. So when I say LH test strips, it's ovulation test strips. Yeah. People are saying, oh, I'm getting my LH test strips, and say it's on cycle day 18, okay? And your cycles are 28 days. And everyone thinks, this is great. This is not great. That means your surge of LH is happening too late in the cycle, and then we're getting less progesterone exposure. This is a red flag from the body, and it's so easy to see in a fertility chart. It's literally in your face. We cannot miss it. The doctor can then see, okay, your body needs something, and then she can apply it in a personalised way, as opposed to saying, oh, we think you ovulated on this day, let's just take a blood test and give you generalised support. That's definitely not what we do.
Oh, me again. So we spoke about the beginning of the cycle, what we can see at the beginning of the cycle. What can we see at the end of the cycle? Ailish led the way. So if we have a shorter luteal phase, your progesterone might not be optimal, and 98% of the time is not optimal. If I see that in a chart, I'm going to try and give you treatment to optimize the progesterone for implantation to occur and for you to have a better chance at staying pregnant and not having a chemical or an early miscarriage, okay? We are talking about the Tempdrop today, and Ailish is the guru of the Tempdrop because she is going to teach you how to use it. And what we see with this is temperatures, your basal temperature. And if I see your temperature that's too low or very unstable, that's a red flag. Well, how's the thyroid doing? or what's happening with the luteal phase. Important, what we see at the end of the cycle, premenstrual spotting. People say it's normal. Oh, but sure, I have 4 days of spotting before my period starts. Nah, it's not normal. This is what we see. We need to see it. It's free. Like you tell me, you give me the tools, I treat you. So you need to do it in order for me to treat you. And it's, as I said, it's free. This is what we see at the end of the cycle.
So another thing again, the luteal phase is, I suppose, to explain what it is. When you ovulate, it's the remaining days in the cycle, and we need that part of the cycle to be optimal, especially in a time when somebody's trying to conceive, because think about it, this is a time when we hope for implantation. We don't want to just focus on did we get to ovulation. We want to focus on how is the environment in that womb for implantation. But this is where we have to look outside of just ovulation. We have to look at things like the thyroid or inflammation or metabolic things, and that's what the doctor does. So you're looked at and treated as a complete individual. That's a really, we'll keep saying this again and again and again because that's what it is. It's individualised, personalised care.
Me again. Other red flags. We can see from your chart when conception happened, because not only we chart our mucus, our temperature, our symptoms, our bleeding patterns, we also chart intercourse, and we all have it because we're trying to have a baby. We can see if we are dealing with a miscarriage. From your chart, we can see the patterns. Why is it happening if it's repetitive? PCOS. Absolutely. We can see them. We don't have mucus. We have very many days of mucus. The follicle struggling to develop, or we don't even have a positive LH test. All in the chart. Thyroid, we said, we look at, with restorative reproductive medicine, we look at every system because your reproductive system is your overall health. So I have to check you from head to toe to understand why. Okay? And yes, endometriosis is a big one. I think Ireland finally starting to talk about it more and more. Still, patients have to advocate for themselves, which is sad to see. But we can see it from the chart if you have very heavy, 3 heavy days of bleeding, passing clots, pain. Because in the chart we have an easy-to-use system where we just scroll from 0 to 10. So if you have period pain that's crippling, you just scroll to 10, and when I do your review each month, I go, okay, you might have endo based on your symptoms month by month. So basically, yeah, the chart helps doctors like me to pinpoint to what's happening, not just like diagnose the symptoms. Ailish?
Yeah, and I think when we're talking about pinpointing symptoms, and we know the big goal for so many people that we're supporting, their goal is to conceive, but also for us, their support system, we want to make sure that they are in the most optimal health in every possible way. We want to make sure they're feeling good, they understand their bodies, and that they understand their plans, because that takes the anxiety out of going through this journey. When you know what's happening with your body, when you see the positive improvements, and that is all reflected in your chart once the doctor can see your chart and apply her plan.
Yeah, me again. Surprise. So timing follicle development and ovulation, and exactly what I already told you, but it's on a slide. If Maria's coming to me and saying, oh, I'm not sure when I'm ovulating, or I don't know if I'm even ovulating, but I do get sometimes a little faint LH test, we'll start charting the cycles. And when I see that the LH test is there, but she's not pregnant, when I do those peak +7 blood, 7 days post presumed ovulation, we don't know if we're ovulating until we know we're ovulating. Because either we're pregnant or you come for a scan when we start your personalized treatment. I can look and say, no, it's not happening. Based on what I've seen in the first half of this chart and the second half with the bloods, I can then give you treatment for your next cycle to stimulate the follicle to grow. Okay? So, sorry, friend. Perfect. Sorry. So again, cycle charting, it's so important for me to be able to give you the best chance of getting pregnant, really. And we can see it through the chart. But I let Ailish tell you a little bit about the peak mucus, because I think that's an important information that you should be able to know when you leave here.
Yeah, so again, we've kind of briefly talked about mucus, and I'll share as much as I can, obviously, in a short space of time. But your cervical mucus is one of the most overlooked biomarkers. If you take away anything, just remember your body is telling you what's happening, and even if it's not giving us those obvious indicators, that's a message in itself, because that means things are not going as they should. So your mucus, again, it comes from your follicle, and that's because of the estrogen that it produces tells your cervix to produce mucus. So when we start to see or feel mucus, we know there's a follicle developing, and then we can contact the doctor and say, hey, I think there is something happening. That allows us to time follicle tracking scans appropriately, as opposed to just going, day after day, or however many days until you think it's there. Your mucus and your LH will really give us an indication of how close we are. Then, of course, we'll use your peak day, which is the last day of any clear, slippery, stretchy mucus, or just this really wet or slippery sensation when you use the bathroom. This is because whenever we're seeing or feeling this sensation, it means our follicle is still whole, okay? Our follicle is still producing estrogen, and that's just as ovulation is occurring. So if we understand this information, we can just make this journey so much easier for ourselves. And that's how we use the mucus and the chart to time these scans appropriately. Because again, restorative doctors, they don't just, use the chart. They want to see proof of rupture. That's really important. Proof of rupture is so important as well initially.
And I think I might add a very practical aspect, what I see in my clinic day in, day out. There's those three markers, right? Mucus, LH testing, and temperature. I need 2 out of 3 to be able to say, yes, you're ovulating or not. I have patients and they said, I can't do my temperature, Dr. Codruta. I hate it. I wake up every morning. I have to do it. Buy it. Like, it's 200 quid. You don't want it after you're pregnant, give it to whoever. Put it on, you sleep with it. It gives me temperature, because sometimes you don't have mucus, and probably here today some people think I don't have mucus. But if I have 2 out of 3, you don't have mucus but you have temperature rise and you have an LH surge, hey, I know. So it's the practicality of having 3 things that will tell me if you're ovulating or not, and we can play with them. I'm not sure. Well, I'll tell you. And then between me and Ailish, all my patients are working with Ailish to understand how to chart properly. And then between me and her during your treatment, we communicate a lot. Because she might look at the chart and say, Codruta, there's something not right there. And I go, okay, let me see. So, yeah, we're sick of each other. We love each other. Okay, we'll go to the next slide, because I don't remember what's on the slide. Sorry.
This is similar.
Yeah. So, do you want to? Or
yeah,
I don't mind. Like, sorry. You can both say.
So basically, with the chart, I'm sure so many of you have had a progesterone test on day 21 of your cycle. Okay, very generalised, very just assuming you ovulate on day 14, right? With restorative reproductive medicine, we don't do that. So the doctors use your chart to say, okay, when is this individual ovulating? And then she will time a blood test 7 days later for both estrogen and progesterone. It is actually mind-blowing that estrogen is overlooked, especially if there are things like fertility medications being taken, because sometimes some fertility medications cause a luteal phase dip in estrogen. If you're not testing that or you're not timing things appropriately, how do you know? The biggest thing that we need to do here is not let anything fall through the cracks, and that's what the fertility chart does. The fertility chart is literally the foundation of the plan, and it gives the doctor everything she needs to listen to your body in black and white.
I like the peak there. Sorry, I've just seen this now. Peak day. Ailish already said, day 21, like everyone is a robot, and day 14 we release an egg. No. I have peak +7, which can be done on day 16 because she's ovulated on day 8. 8 + 7. I'm no good at math. So depending on you ovulate, I have so many patients came to me oh, the doctor gave me letrozole and I'm not pregnant yet. But did you check your estrogen? Because you know what's happening when you take letrozole? Your estrogen dips in the luteal phase and your embryo is not going to implant. Or you might miscarry because you have a very low estrogen and you need both hormones to support the pregnancy until that placenta is taking over and the little fetus is giving a little bit of progesterone and estrogen as well. So forget about this day 21, like that is old school. What we do now, we live in 2026. Hey Alexa, turn on the light. What about, hey Alexa, when is my peak day? That's hey Alexa, because this is how we see, you know, this is it. It's your Alexa now. And you know, and you're like, actually I've ovulated on day 12. 12 plus 7 is 19, right? Now, what are we going to do if it's a Sunday? We do it on a Monday. Peak plus 6, 7, 8, or 9 will do me so I can give you the right treatment on next cycle. Jesus, a lot about peak, okay.
Yeah. It's such an important part.
Yes, it is, though. Everything is important.
Okay,
oh,
this is
just me again, sorry. So, I already probably told you everything that's there. If I have to give you targeted treatment for follicle development, I'm not going to overstimulate you because it's natural conception that I'm trying to achieve. That's the other side of things where they want to stimulate you IVF to give you more follicles. With my treatment, we work with nature. Restorative works with nature, with your own body. If I need to give you treatment, where will I give you? Again, the chart. And you know what's going to happen. You're going to come for review and I'm going to ask you what days of the cycle you took your letrozole. We don't remember what we did 2 days ago, do we? No. But you put medications in the chart. And then I'll just open the chart and say, oh yeah, you took it on day 3 and 4 or from day 2 to 10 or whatever pattern. It's important when I'm giving you medications to understand that if I have clarity, I know your chances to get pregnant at the end of this cycle that we've medicated. Very important, thyroid, because temperature, you know, I see the temperature staying low. And I'm like, oh, thyroid is not great. Let's do a thyroid test and let's see, do we have to change medication, up or down the dose or whatever. Some medications are given exactly after confirmed ovulation. On the first cycle of medicated, let's say first cycle of medications, I always do follicle tracking scans. And again, I look at your charts the previous months to know when are you actually going to ovulate. And I'll say, I need one scan pre-ovulation to see your response to whatever I gave you to stimulate you with. I need a scan on peak plus 3. And what's that? 3 days after you've ovulated. And why? Because many patients who failed treatments with letrozole, they had unruptured follicles. So if I don't see it on the scan that that big follicle is now gone and I have a corpus luteum, I'm not winning. People say, well, why are they getting pregnant so quickly with you? Because I see things. And I educate my patients to understand what I do. There's nothing like, this is your prescription now, Maria, bye, see you in 6 months. No. Like, we work really close together for me to understand you, for you to know why I'm telling you to take this on that day, why to do your bloods on that day. We have Ailish, you know, so it's a lot of people working for you to have your baby. But that's timing medication correctly.
Okay, so we have of course talked about why temperature is so important, and it is a biomarker from the body. And I'm just going to explain for anybody who doesn't know this, because lots of people don't, and that's okay because we are where we are. So basically what happens is after you ovulate, once your follicle ruptures, there are new cells that form the corpus luteum. And the corpus luteum produces the hormone progesterone. Progesterone comes into your body and it basically stimulates your thyroid, causing a warmer environment in your body. There is a small but significant shift in your basal body temperature. So what we see with temperatures, if you were to wear your Tempdrop every night, you would see a temperature trend that would be quite low until you ovulate. And then once you ovulate, it's literally like the temperature rises and stays elevated. And from a hormonal perspective, that means progesterone is now in your body. And the amount of days that your temperature stays elevated for tells us how many days progesterone is in your body. If we all of a sudden see, like a drastic drop and it's only peak plus 10, we know there's something going on with that corpus luteum and it's breaking down too early and your progesterone is low. It's such a quick indicator. And, this is why your temperature is so, so important. And this little device, okay, it's literally a game changer.
Absolutely.
It really, really is. For anybody who's using a basal body thermometer and they're waking up at different times, or they just you're working on shifts, it wouldn't be right for you. This just takes all of the worry out of it, and it gives you information that is invaluable. Okay, there's initial investment to learn about this, time and a small financial one, but forever you will have this information, and it is so worthwhile. I can promise you that it is so, so valuable. So this is why your temperature is so important.
Yeah, just sorry to add on that. I have charts. I open them. They're messy. I can't understand anything. Temperature looks like. Do you remember the slide with the pick? That's not the temperature that you need to record, because people who are not using Tempdrops, they're using normal thermometers. They don't check their temperature at the same time every morning or every night. You need to literally go by 703, well, 703, but then the weekend comes. And then they don't want to wake up at 703 to do their temperature. I don't understand, because they might not have mucus and the LH is not. So I only have one thing left, and that's the temperature. So when I started doing restorative reproductive medicine, this was not available really, and people were doing it with the thermometer. It was a pain, and patients being upset in reviews with me. I'm done with temperature. No, yay, technology. So yeah, as Ailish said, maybe you have to invest a little bit at the beginning, but it's worth it, because in itself, it's a diagnostic tool. Mm-hmm. I don't know what's on the next slide.
So this
well,
is
I just said.
So this is why we recommend the Tempdrop, because, of course, we ask everyone to track their temperatures every single day, and instead of using a basal body thermometer, which would require you to wake up at the same time every morning and take your temperature while still in bed, and sometimes that's not just practical. Lots of us can't do it, myself included, and this is why I use and recommend this. And it is just going to keep that stress down at a time when you just don't need any additional stress on this journey.
And I think just to add there, my patient says, yeah, well, I have this ring, or I have this watch, or I have that. The beautiful thing to this is that this will sync your temperature in our chart. Time one there. And then the Aura ring or whatever ring, I don't know how to sync them. They don't even know. Patients come and they show me this screenshot, and I'm like, sorry. I don't know how to, how can I give you the best treatment? I might have to take some courses for other things, but I'm very happy with this. So, yeah, this is why we should use it. Go.
So, basically how it works is you just wear it every night, and it takes your temperature throughout the night, even if there's things like, you're waking up, or if you're breastfeeding, or for scenarios when you can't use the thermometer. This is just going to eliminate all of those problems. It's so quick. You just wear it to bed. It's not uncomfortable. The next morning you sync it, and it syncs to our app chart. Well, not our app, but the app we use. The app we use. The app we use, and it's just in an instant. And like I said, for us, it's just about keeping the stress down for anybody who we're supporting. That's really, really important. And honestly, this is one thing that absolutely does it. It truly, truly is great, and it's reduced stress for so many of those that we support. So, that's really important. The feedback from others we listen to, and FEM, the girls are here today over at the stand F42. They are so helpful. If there is anything that people want to talk about, or any questions, they're there. They're there to explain. Or even before, if you're on the fence about purchasing it, they're there to help and answer those questions, because obviously, you want to make sure your investments are worthwhile, and it's good to have real women just there to answer your questions and be direct with you. So we went through that one as well.
We're very fast, eh? Yeah, so consistency, same. We've discussed about that. And then again, for me, absolutely fantastic to see your temperatures the same Mucus is giving me fantastic information. Temperature is giving me fantastic information. LH testing can give me fantastic information. It's all really a mix of things. But I think I would like to just make a point of what Ailish said. The fertility journey, guys, it's a hard one. It's complicated as it is. You're not here today because it's easy. So if we can do something that's easier, I think it's worth investing in rather than going for super expensive tests or super expensive gadgets that they're not going to help me. Come talk to me. I'm on Instagram. Ailish is on Instagram. Send us a DM. Ask. Like, you know, we're there for you. Like, we work very closely with our patients, and some of them are here today. And they know how we work with them. So look, it's it's handy. That's what I would say, handy. Wow, we've talked about all of this.
We're flying through it.
Yeah, so... Oh, we have a closing message.
We do.
Yeah, well, all this, obviously, I used to work nights. I still work some of them in the National Ambulance Service. And if somebody, my doctor, would say, will you do your temperature? I would, no, sorry, no, I'm too tired. And all of us are tired nowadays. So again, it's important to keep doing the act that will tell me as your doctor how to treat you, and not to stop it because of tiredness or shift works or, you know, baby's crying and, you know, yeah. So I think that's quite important to know. Oh, maybe we should say it together. No. Obviously, in restorative fertility medicine, the cycle, it's not just the bleed. It is very good, measurable, interpretable, and treatable. This is a mouthful. Exactly what I told you at the beginning. Your fertility chart mirrors your fertility patterns and how fertile or infertile you might be in that cycle. Give me a good chart, I'll give you the best treatment. That's what I tell all my patients. I understand a lot. I know how to help you. I think that's it. Wow, thank you.
Thank you, everybody.
Thank you, but we have a few more minutes and I want you to ask questions and don't feel shy. Like, I'm around anyway, you can come and ask me directly, but if you have any questions about what we have discussed today, now here, me and Ailish, feel free. We're here. You've paid to be here, so use us.
And we have a mic, so if anyone wants to ask...
Oh, we have a mic. We have a mic.
You can just pop your hands up.
No?
No questions?
We were very clear. Yeah, okay, that's good.
I usually don't have questions either.
Same. But look, if you do have questions, even a DM, you know, we'll respond. Yeah, it's been a pleasure. And just a closing remark. Today is going to be hard for you navigating this. Yeah. When you got your information, go. Enjoy the sun. Don't hang around because it's confusing. Okay? Thank you, guys. Thank you.